Brought to you by
Your Health Chart is brought to you by National Medical Stores, who are mandated to procure, store, distribute essential medicines and medical supplies to all public health facilities in the country.
Good evening and welcome to New Health Chat here on UBC. I'm Dr. Henry Dungu, and this program is proudly sponsored by the National Medical Stores. The COVID-19 pandemic is in the second wave. As we all have known about this, a number of people have been affected with the disease in one way or another. Either they have suffered the disease or they have their loved ones who have the disease. And many people are struggling on how to cope with the disease. Tonight with us, we have a special guest in the studio, Dr. Nambatia, who is known to so many of you viewers. And Doctor, maybe I will allow you to introduce yourself to the viewer.
Good evening, viewers. I'm Dr. Grace Nambatia Cheuni, Director of Research in Natural Chemotherapeutics Research Institute and Ministry of Health, that's located in Wandegea, opposite Ministry of Public Service.
Thank you so much, Doctor. Welcome to have you on the program.
Thank you.
You know, you talked about natural chemotherapeutics.
Yes.
Maybe you can throw more light on what that one means.
Okay, as the name stands, it refers to those natural chemical ingredients that are utilized in treatments.
Okay.
So the name natural chemotherapeutics is derived from that.
Is it different from the usual chemotherapy we hear for cancer patients?
Yes, it's different in a sense that the chemotherapy, these are now synthetics, mapped on nature. So majority of the chemotherapeutics are synthetics because they have to prepare quantities for the whole world.
Okay.
So they start from nature, identify a molecule, moderate it for what it can do, find it can be good for cancer, and then they do produce it synthetically.
Okay.
Yes.
Well, that's very interesting. We are going to be talking about the natural, not the natural chemotherapeutics, but
Yeah.
lots of things that are related to that.
Yes.
But our focus tonight is COVID-19
Yes.
and use of some of these products.
Yes.
Now, before we go into that, we know that there's a second wave,
Yes.
and you are a frontliner in this.
Yes.
Just give us a sneak peek into this of the second wave. When did it begin and where are we at the moment?
The second wave was declared recently. May not be precise, but we remember the latest address to the nation by His Excellency. It marked the beginning of the second wave. Could be a week back, probably, because we all remember when children were called back from school. It marks the beginning of that second wave, where we saw that this is punctuated with variants from UK, from South Africa, from India, and targeting a different cluster, that is the youth. Yeah, so and the rapidity and the fact that you don't have to have flu or cough, you can pick it depending on your immunity, and the numbers are really rising. So that is marking the
first wave.
second wave. Yeah.
And I know many people, well, they know about COVID-19.
Yes.
Since we are looking at coping with COVID-19 at home, of course, there's still many people who believe there's no COVID-19. I hope that is now clarified, that COVID-19 is for real.
Yes.
We've seen quite a number of people who test positive.
Yep.
But we are told that a small fraction is the only one admitted in hospital.
Yes.
What happens to those
That
who
are
are not in the
not.
hospital?
Actually, that was also highlighted by the head of state that the fraction in hospital is small. Meanwhile, the ones tested every day, they're as big as like 1,000 now.
Yeah.
So, which means a big number is in the communities, which means um, uh, there is need a lot to orient ourselves on how to handle community infections. The good thing is that I think as Uganda we already have a community engagement strategy. I think by Professor Maswa.
Okay.
That was put in place and guidelines are already there. So it's for real that majority are out there, and it's very important to really get to know how to handle, because transmission is very fast. These variants are very efficient, and it's for real. Few people are in the hospitals.
For someone who is at home, what are some of the common symptoms patients present with when they have COVID-19?
Yeah, actually, they talk of high temperature, fever. Some talk of like weakness. Someone says no energy, but the symptom of losing sense of smell is also very common. Loss of appetite, dry cough. Those are some of the, and headache.
Headache, dry cough.
Yes.
Loss of sensation.
Yes, sense of smell.
Sense of smell.
And
yes.
appetite.
Okay.
Yes, and that dryish cough. They are commonly mentioned symptoms.
Okay.
Yes.
So, assuming someone has been having these symptoms, would you recommend that they start on certain treatment? What should they do?
It would be very, very important to go for a test, because first of all, for me, people have been like asking, or like when they tell me I have a fever, and knowing that irrespective of COVID, malaria is still the #1 killer, I guide them to go for a test to rule out malaria first and foremost. Then when they find it's not malaria, to proceed with a COVID test. Because by establishing early that maybe you have COVID, there are many things you can do that can maybe not end you into ICU, where it may be a journey of no return. Yeah, so testing is very, very important. But the challenge is that not many people can afford, and the tests are quite expensive. And I've learned that upcountry access to these tests is also a challenge. And we know there are a variety of tests. Not all of them are sensitive in the same way. So if in Kampala it's hard to reach a very sensitive test, you imagine what happens in a rural area where somebody could listen in and say, yes, I want to go for a test. But then which test is also another issue.
So, Dr. Nambatia, when you say that not all tests are effective or are sensitive enough,
yes,
does that mean I can test positive when I'm actually not positive? Or I can be negative when I'm not negative?
Incidentally, with COVID, it's happening.
It's happening.
If you test in 3 different places on the same day, you might get a positive and a negative in another place. Because when it's for COVID, they may maybe take the sample from the nose or the throat, and the two it seems presentation is different. Yeah, these are, it's like learning points. When you listen in, new disease, new ways of testing, when you listen in, you find these are real challenges. These are real challenges because so you may have those 2 results. So it's as if you should maybe even invest in testing more than once, depending on the timing. Because if I got the virus today, and probably I tested 4 days later, then I may even I may be found negative. But meanwhile, the virus was for real. It infected me. The way it manifests quickly does what it does, and then it goes away. You find somebody testing negative, but they're very sick. And this I'm now talking of realities out there, where people say, My person didn't have COVID, had pneumonia, didn't have COVID. And it's reason for people to be near the body and to do whatever they have to do. It's really happening there. You find many people work keeping, they are in a tent, congested. That happened a lot in the first wave. But second wave, where the transmission has changed, you could see why the transmission can be very fast.
Very fast.
Yes.
It's moving away from how it used to be.
Yes.
Oh, this is interesting. Now, Doctor, you've talked about the fact that the tests are expensive.
Yes, they are really.
The disease is everywhere,
yes.
But testing is not everywhere.
Testing is not everywhere, and again, testing requires gazetting. Not every place is gazetted.
Gazetted to do that.
Yeah, because now if you are to travel, I'm sure some results may not be accepted. Yeah. Meaning there is gazetting because the diagnostic kits need to be authentic. Because we are in a world where there is faking things. So you can't rule out wherever there is something useful, there is a fake somewhere.
A fake thing, yeah.
Yes.
So in such a situation where I am not able to test, but I have the symptoms, what should I do? I'm at home, I have these symptoms, what should I do?
Yeah, actually, in a situation where you can't test, there are, things you could do that relate to supporting the body to eject the virus in case it's there.
Okay.
You may not know, but steaming, whether there is a herb there or no herb, just the heat alone of the steam, by nature of the virus, this heat will disorganize the virus. We talk of pineapple. This is based on what has happened elsewhere. We've had in Australia, they've leveraged on pineapple to extract out the juice. It has bromelain. This is an enzyme. We know what enzymes do.
Yeah.
We use them in softening meats. If I cut my meat and mix with pineapple, definitely it will soften. But what is softening it is called bromelain.
Okay.
So these researchers out there who have budgets for research have leveraged and concentrated the pineapple juice and used it as a spray, especially with frontline workers who engage with patients a lot, in a sense that they may not test every hour, but they keep disorganizing the virus by spraying in the nose. But here in Uganda, for me, I've leveraged that information to guide people just to eat the pineapple, to eat it, and also to, like, when you look at a pineapple, it has this midrib, the middle, the stem.
Yeah. Sometimes you cut it out and throw it away.
Because it sort of gathers all the toxicity, so it has that mechanism. So for the researchers, they've leveraged on that. The concentration of bromelain is in that one, so they soak it in water overnight and then keep taking that water. And when maybe somebody starts out simple in a home like that, but in a laboratory you can go further, concentrate this and make a product, and that's what the Australians did. But then for me, I thought, here we have pineapples, and coincidentally there have been plenty since COVID started, and they are so cheap. And you see people laboring, begging you to buy 7 pineapples.
Now you're going to make it expensive.
Yeah.
Now that you've talked about it, you're going to make it more expensive.
Let it be, because I believe growing pineapples is not easy.
It's not easy.
And people are crying out there, government to Yambe, and there is pineapples, people begging. Now that I have an opportunity to talk about it, in natural products, God puts a remedy where the disease is. So these pineapples are there, simple remedy, very simple, and they could really be, if you really embraced them, you could prevent the virus from proceeding, because when we touch our eyes, the nose, the mouth, those are points of entry. You could, like for the mouth, you could disorganize the virus while it's still there. But of course, when it gets further and you get a cough, then it's gone into the system, then that's a different story. But for me, I think those are the very first things that are in the communities, so available everywhere. When we talk of bromelain, we may also talk of papain in a pawpaw. Papain in a pawpaw. So
bromelain is in pineapple.
Yes.
Papain is in
pawpaw. That's why we use pawpaw to remove gummy stuff on our hands. Yeah. So just that simple information like that can make people appreciate why, if somebody is having this vigari on the roadside, having purples, having pineapples, we should give them business. Yes.
And as we give them business,
Yes.
we get healthy.
Yes, we get healthy.
So you talked about, I'm at home, I've not been able to test,
Yes.
but I want to keep my immunity good.
Yes.
Okay. Are there other things that one should do if they have the symptoms but they're not able to test? Should we just assume that we have COVID, or?
It's good to assume.
Okay.
Now that it's in thing. Okay, of course, in the community, in the home, it's very important to think of isolating yourself. Though when we talk about isolation, we imagine a house has rooms, people can be in separate rooms. Some places don't have rooms, but at least you can use a shield on yourself. A shield, first of all, a mask. Some you can go ahead to put a face shield. At least you shield yourself away from the others. Help them to also help isolate you. Other than, so it's like, it's no longer like another infection where you have to hide. It's very, yeah.
So if I got you right, isolation is not necessarily hiding into another room to be by yourself.
Yes.
Okay.
Because the rooms may not be there.
Of course.
Yes. So you could, because isolation is the cheapest, because it's not even like using a mask. I need to pay for this mask, but being apart is the cheapest, and they say it's the golden, because if I'm not near any infection, so you can also strive to improve your immunity bodily using hot and cold. For example, you can have a basin of hot water, soak your feet, alternate hot and cold. It's a method that improves immunity. It's used a lot by mothers managing fevers in their children. Like before as they go to hospital, they do the hot and cold. It could be a shower. You shower in the hot, the cold, hot and cold. There is a way it really boosts immunity. Okay. All this information actually is documented, only that we're a society that doesn't embrace reading. Everything is there.
You've written it. You've shared.
I may not.
You and your team, all health workers of government, or in the world. Okay.
The world. Yes. We talk of Mr. Google. These things are there. We just need to read and then sort of domesticate them.
Okay.
Domesticate them. So the challenge of sharing is very important. We can domesticate in our languages. Okay. Yeah. So another way is exercising.
Maybe before you go to exercising, going back to isolation, how different is isolation from quarantine?
Okay, quarantine tends to really be
imprisonment.
It's like gazettes, walls around you. But things are really very serious. Like it was when we went through Rio quarantine, we hear quarantining of animals, Rio boundaries. But I think isolation, it could be a bit transient, trying to, it's like it's not too strict as
isolation.
Yes.
Okay, isolation is milder than.
Mild, yes.
Okay. All right, that's very interesting. And those of you who have just joined it, we are on UBC, U Health Chat. We are discussing COVID-19, looking at the real life issues at home, what one can do when they suspected to be having COVID-19. And we are with a super expert, Dr. Grace Nambatia, who is taking us through all these issues so that we get to understand more on how to deal with COVID-19 while at home. Going back to keeping fit, you are talking about exercising.
Yes. Yes, and the simplest is walking. Walking, only that one has to walk in a safe place, because these days we have borders which keep left and right. Yeah, people have lost their lives when they're really sort of, So walking is the simplest that doesn't strain you a lot. Okay. Exercises could be in many ways. Even breathing is an exercise. Breathing in deep and out. Yeah, because when you breathe in deep and breathing out completely, somehow you also breathing out that virus. That's why you have to also care for where you really do the exercise.
Okay. They
Simple.
even told us you can do it from your house. His Excellency demonstrated.
Yes, because exercise will improve movement of body fluids, like the lymphatic system, which is supposed to also
Clear.
keep Though this time around, we could also talk of utilizing nature like the sun. The sun has a way of reacting with the cholesterol under the skin to make vitamin D3.
Okay.
This D3 really boosts immunity greatly to the level that some scenarios talk about it as a treatment. But of course, this depends on whether, if you are checked for vitamin D3 levels and they see how below you are from
the
normal and address that deficit, you could find that you are one of those who may not come down with COVID-19. This is documented, and some countries it's mandatory for anyone above 50 years to really be given
vitamin
D3
D3
as a supplement. It's not cheap, and part of research going on in Uganda right now is in the area of D3. They are first establishing the levels generally across the board. Then after that, that kind of research will go into a phase of recommending supplementation. Yeah, but the sun is a natural way of getting it, though our black color filters out what is necessary to make D3. Yeah, so it's important to enjoy the sun deliberately. Like you go into this sun, which is friendly, like at 10 o'clock, but you may need to take off your shirt or blouse and really, but most times you find the sun is good, but we are in offices, we are in air conditioning, and some of our friends maybe in cold countries, they suffer more with this COVID-19 because they are black. The black skin doesn't even allow the little sun there. So, but here, D3 is a recommendation by Ministry of Health. They've recommended 50,000 international units as a supplement, and it's there in pharmacies. But it's very important to check first to see where you stand in relation to the normal levels you should have, and then you are prescribed, because there are other units, 3,000, 5,000, though a ministry putting 50,000 means they are looking at a sick person. COVID-19 it would be so friendly to people with very low vitamin D3. So I think to me it's in that context. But we have food sources that have D3, like mushrooms, the dry mushrooms, mukene, spinach, some white meat like rabbit, and others. Because sometimes it's not good to give too much information. We want people to just be sort of triggered into looking for more, so that we eat for a purpose. Yeah.
Wow, this is very, very interesting, and a lot of learning that we are getting.
Yes.
The sun in the morning.
Sun in the morning and the evening.
And in the evening.
Even our great parents used to say, take that old person in the sunshine. You know, people who manage to make it to 90, like they say in Uganda here, they say balimuwalulira kaliva. Those were the things. They used to put these old people in the sun, and they would get vitamin D3. It strengthens the muscles, the bones. Then the D3, incidentally, D3, even if you have a challenge like diabetes, hypertension, and your D3 is fine, if they give you medicine in hospital, it will work as expected. But if D3 is very low, you will find yourself going back for other prescriptions. So there is need to link, what is given out there and to what you should do to address the cause. Yes.
We've done exercising.
Yep.
We've done eating papaya, eating pineapple as ways of boosting our immunity.
In case you are not sure, you can't test. You pick those. Eventually, the virus will just get out by itself because it's of.
And from your discussion, it looks like even before one gets symptoms, it would be a good idea for them to get into that kind of habit.
Yes, it would be, because really the affected, it's like immunity levels may say a lot regarding as to who will be affected. Yeah,
Okay.
that's why. Well, initially the youth were vibrant and probably immunity high, but in any case, for most of the viral challenges, immunity levels matter a lot. Yeah, because what they do, like the COVID-19 virus, it disorganizes the immunity system in a sense that it causes most of the immunity stakeholders or whatever to act at the same time. They are awakened at the same time. And then they cause what you've termed as the cytokine storm. It's like here you find the army is up in arms, the LDUs are up at the same time. Definitely the body gets overwhelmed. Yeah, so, but if you've been found with a robust immunity system, you may not be affected to the same level. Yes.
So it's important for all of us to actually get involved in this.
Yes.
Now, the issue of COVID-19 at home and steaming, you alluded to it a little. And we've seen many people, when I look outside, I can see lots of herbs that have been used.
Yeah.
Which are the best herbs to use for steaming?
Yes, the best herbs to use for steaming are the gentle ones we normally use in our tea. Can start with mujaja. Yeah, it's been gentle and you are used to it, and that aroma is meant for, in fact, it's a treatment. The aroma is a treatment. When you analyze that aroma, it's made up of small alcohols that can easily infuse in your system and probably stimulates your blood flow, energy. So mujaja, people know it, but we could talk about peppermint. Peppermint is very, very good. And in Wandege, in our lab, we extract it. You know that aroma, you can extract it. And you just have, you can dose your mask. That is now adding value. Dose your mask. And as I put it on the whole day, because what I breathe out becomes stale, but the peppermint will keep it fresh. But when we say peppermint, there is spearmint, there is mint, and we can even mix all those. Because when you mix, it's like these different components synergize each other, and the effect lasts even longer.
So I get mujaja, I put in peppermint, I put in spearmint.
If you have them, if you don't have, you can use one.
Okay.
People know a lot what we call cinnamon, mudalasin.
Mudalasin.
Even there is lemongrass.
For the cinnamon, do we get the bark, or do we get the leaves?
The bark. Yeah, you can get any
of those. Okay.
Yeah, though for a plant, we encourage more to use leaves, because picking leaves doesn't kill a tree.
Oh,
but
right.
taking a stem,
you're killing the tree.
You're killing the tree. So the issue is to boil. You can even have just a percolator, boil and that steam. It helps you. Though still that aroma can also be handy in chasing away mosquitoes. Rosemary, there is rosemary. These spices we use in food. Rosemary is also a very good one. And in a sense, though when you use it at night, you may lose sleep, because
when you use rosemary.
Yeah, because it helps you if you're a student and you want to be awake longer. But it makes you alert. That's why it's called a memory booster. So, but in science, we can trap that steam, condense it, and get that oil. And below the oil, we get that water, which water I can use to put in my nose as drops to open up, because that distillate is full of all those components in rosemary.
These are plants that are easily available.
Yes, actually, when you move around and you see people selling these on the roadside, all these plants are there. Rosemary is there, lavender is there, mint is there. But when you come to Wandegea, we specialize in the medicinal plants, those that I'm talking about.
Okay.
But of course, you may be so far away from us. You just need to ask those people. They know those plants.
Okay.
They are really selling
Dr.
very
Nambati,
valuable plants.
there's a plant that is everywhere on social media. Unfortunately, I don't know what it is. I don't know if you've come across that.
I know it.
What is it called?
Verbena officinalis. That is the Latin word. And of course,
do you have a local language for it?
Local language. It's called the. Oh my God.
Because it's been moving everywhere, and they say maybe a branch or 2 branches will go for more than maybe 10,000.
I have the local name right now. It's
gone off your
when I get it out. I have the local name, but it has just evaporated from my head.
Okay, that's okay.
Yeah, but that plant.
Does it truly cure COVID?
Well, COVID is a new disease, and I wouldn't say somebody has done a clinical trial to establish that. But when you read about it, because it's already documented, given that it doesn't originate here, it originates from Jamaica and other places. What has been found in it is like it's very good as a stomach tonic.
Okay.
It's very good for chest infections. It's good for lowering depression. It may tone down a headache. It's mentioned as useful against symptoms that feature in COVID. So, given what has already been documented and what people are mentioning about it, I think people may not really be very wrong in sourcing for it. The only thing is that we need to search more about it regarding potential side effects. For example, if one is pregnant, they should not use it.
Okay.
If one is breastfeeding, they should not use it. Yeah. So that is a beginning. When you see people going for something, yes, you quickly search and say why, and from what I've even dysmenorrhea it can handle. But then you get to know that for every if it's a coin, there there is you need to flip it on another side. And then this is where you find herbalists mixing it with something else, probably to remove the other bad sides. Yes, the science now starts from there. So when people learn about some of such a thing, it's important they seek more guidance on use. And our institution that's an area where when they come, we can give them free information. Herbalists can be trained in optimizing it to ensure that what is looked at as a bad side is sort of neutralized. And like India, because we have these areas, countries like China, India, who have excelled in this sort of use of traditional medicine. What is it that we are not regarding, using herbal medicine is not all about picking a leaf that you have told you it does this and you think it will do that. Using it as medicine is another story. And you will find that, like if it's in India, it's like every plant has a male and a female. They would need to combine, they describe it that way. They would need to look at the characteristics of this one. Probably it raises pressure, then they combine it with the other one that lowers it. They optimize, and then they have the formulations. And that is where we want to go. Yeah, so we are at that level of beginning that this Mujaja does this. The simplest, get information from those who have used it. Don't just use on your own thinking, because some of these plants are very, very potent to the level of killing. Yeah, like there is one commonly known as Wabugia ugandensis or abasi. Swahili word as you hear abasi, meaning it can treat almost anything. But then the dosage, you use a very small dose. This plant can work. We are moderating it in 1 day for COVID.
Okay.
It can work on tuberculosis, but the dosage matters a lot, you know.
Now that's the challenge that we have.
Extremely.
People tell us that when it comes to herbs, you don't have to worry about the dosage. It's natural. And now you are saying you have to be careful about some of them.
There is a plant called Datura stramonium, madudu, where people commonly know, oh, somebody was given this madudu, you know, when they are drinking communally, and the person is dead. These plants that have what we call, there are those components, cardiac glycosides. People long ago used to smear their spears with like
those kinds of plants,
and an animal would die instantly. That component goes straight for the heart, you know. And these are plants that have been used to extract the very first medicines, like for, you know, like what you may call odema, meaning the heart is the one, you know. These it's from those that they discovered heart therapies. Yeah. So it's I mean a poor assumption to think everything is safe. Some are real prescription herbals. Wabugia ugandensis, and I see a lot of formulations in the market with Wabugia ugandensis, because if I'm looking for herb that can work and I found Wabugia, definitely I know that is potent. But the next thing is how much is it in there, you know? Because you just need a very tiny thing to cause some
I think this brings out a very important message to our people, that even if it's natural, it doesn't mean it doesn't have.
Of course.
And I like the idea of you saying that there's some prescription-only herbs.
Oh my God, yeah, like that.
And those that you can buy over the counter.
Yes.
So are you able to regulate them?
Incidentally, the regulators are now a different body.
Okay.
That's National Drug Authority, but I'm a board member, National Drug Authority.
And that's why I was asking you that.
Yes. Actually, I'm happy to say that there is a lot that has been done, especially within the pandemic. There is already now a state-of-the-art laboratory that can check any herb on the market, formulated, to really clarify whether, talk about aphrodisiacs. You'll find this research has been done in NDA, and 40 different samples were found to have sildenafil.
Really?
I'm telling you.
In the sense that sildenafil is from the plants, or some people added sildenafil?
They buy it and they add.
You see?
So this lab now is helping a lot to flag. They'll flag a product, yeah. Actually, I've remembered the other name of the plant, Kalunsambulida. Kalunsambulida.
Okay.
So in NDA, what was really challenging us were lack of a legal framework on traditional and complementary medicine, because that framework brings forth a council, which now is the center for liaison between any regulator. It was lacking. You could imagine NDA's mandate being on the product, but you can't deal with a product without dealing with the person making the product. But now under this pandemic, there is now a substantive act of parliament for traditional and complementary medicine. We just left with having it implemented, so that there is a council, and on that council, you'll be surprised to know who should be on the council. There should be like a dean of a particular medical school, like a director of clinical services, me from research, I should be there, NDA, and then representation of herbalists and traditional, you know. So you imagine such a council, the consortium there would carry through the voices, you know. So lack of that hampered us a lot. But when we had total lockdown, which I witnessed because I could move on the roads, and there was totally no car moving, and the president said we should make our own things, our own medicine. The long journey started, you know. The long journey started, and since then, stakeholders in that journey have been strengthened. Only that the public doesn't know yet. People keep saying, people think that the public, the government hasn't done anything or whatever. I'm happy we are deliberating on this, because one way we want to inform people. A lot is happening. Yes, COVID has really baffled us, but there are also opportunities that have come forth, because sincerely speaking, you could move on any highway from Kampala, you could think people are competing for destroying biodiversity. Up to Kavale, you find after cutting the trees, they start now breaking the stones to create, so, but so now that we have a law in place which can talk to other laws, like for wildlife, because if we destroy biodiversity, we encroach on these wilds, like we encroach on them, and then we start sharing viruses, because the viruses we are talking about are not very new. They've always been there, but in their own
ecosystem,
yes,
environment.
But now we are, so
we are actually intruders.
So we are paying the price. That's why we need to learn to live with this, whatever this organization, because it may not just disappear like that.
So, Doctor, you brought out a very important aspect, and we have so many people who are at home and are indeed taking so many concoctions.
Yes.
To the extent that some people who have been doing home-based care are brought to hospital when they're getting worse.
Yes.
When you ask what they've been taking, it's a number of things. Their oxygen levels drop significantly because many of them are using Njaga. They are using, lots of other things that they're put in combination. I don't know if you can throw light on how effective some of these are. For example, Njaga in particular, because now it is selling like hot cakes.
Wow. Then people have to be arrested because it's illegal to deal with, at least as far as Uganda system, and this is for protecting society, because we know, first of all, Njaga has varieties, but we don't as yet have a mechanism of differentiating quickly that this is the one we don't want. There is one that is quite good, that has low, we call it THC. THC is the one that makes somebody high, but CBD, cannabinoids, this is the one that is good, because a human being has cannabinoids. These are sort of points in the body. They are like nodes. Like when you look at telecom, or there are those nodes.
The junctions.
And in a human body, when those junctions are not operating well, one plant God created with all possibilities of reinstating the junctions is cannabis.
Oh, really?
But it's a particular variety. Now the challenge is in ensuring that people are propagating the right variety. Of course, with such a thing, you would be sure for abusers to come in. Yes, countries have developed this, because medicines for cancer, for real, I even have a document on my desk for clinical trial of a product already made elsewhere to do it here for COVID, for cancer, but we waiting for a legal framework to really operate within as a researcher, because you will need somebody cultivating it, but then those cultivating will need to ensure they protect, So we still are waiting that framework that can ensure that when we use, it's a win-win situation, all stakeholders. You don't want to do research and then have other people abusing this. It's a very highly medicinal. I think our neighbors, Rwanda, have already taken it on, but it requires a very organized infrastructure of, regulatory framework. Our government was working on this before the first pandemic, but now the government that time expired. We now have a new government. I believe it's going to be on the agenda, purposely to see how we could do medical cannabis, and I'm hopeful. But at the moment, some of the products done elsewhere, well moderated and regulated, have access to this country, and through our center, people can access them. They come in, and they can be used under guidance. Now in homes, yes, people really use that, and it can lower that lowering of oxygen levels. Overuse of zinc can compete with iron. In the guideline for ministry, there are too many guidelines for home care management of COVID. They are very clear on ensuring that you have a way of monitoring oxygen. It's something to mentor our people in. For us at our center, we have a pharmacist. Once somebody rings in to inquire, we link the pharmacist to the home to guide them on how to access even those gadgets that can show you the levels of oxygen, so that they can know that once oxygen levels fall to a certain level, then it must be a hospital case. Yeah, but
So
now
in that, do you recommend that as part of home-based care for COVID-19, one should be able to have access to a monitor?
Yes, and they're not expensive.
Okay.
Yeah, what I see, some of these things are on social media, but I think we need to sort of pick out these with the guideline,
Okay.
and then have a way of cascading this information. What our people need is that sieved information, because they even miss out on the good information, because it just drops in. You may be even on a platform reading and something drops in. For me, actually, I'm very, very low at reading WhatsApp, because you just get overloaded.
Okay.
Really, because cannabis used without guidance, we know very well how it can even affect your senses and all that kind of thing. It's good, but it needs to be a regulated product. And we're talking about cannabis, but others are using cut. There is this cut, Myronji. And unfortunately, the regulation is not clear. But when you read about it, I mean, you may have no kidneys after some 2 years, We see people, kidney problem, dialysis, what, but who asks how it came about? These are things you use recreatively, thinking it's okay. There is even no law, but at the end of the day, you pay heavily, when you get in there. And people, I wouldn't want people to think that we only saying use only herbal. No, there is a time for each type of therapy. There is a situation where you must go on those other therapies because you didn't take care. And the Musawa is also trained to handle an emergency. Yeah, so, the other food thing can't work at a time when it should now be the other, thing.
Home-based care for COVID-19 is really important.
Yes.
And I'm glad you've thrown light on this. And I really want us to go back and help us highlight what you feel are the most important remedies that one could use. Just to sum it up, as you said, when you're steaming, let's use this and this.
Yes.
If you don't have this, you can use this.
Oh, okay. Yeah. When you're steaming, you can use rosemary or lemongrass. Etsubi. You can also go ahead and take tea leaves, which have that chisubi. I see a lot of them in supermarkets. Yeah. For eating, you can eat raw onions. Raw onions can be easy to eat if you squeeze lemon over them. The way the Indians do. Because those onions, what makes your eyes cry is what can improve digestion in the system, because you also need a digestive system that works well. You can use garlic. Garlic also has that sulfur smell, but if you added lemon on garlic and put a little honey, if you cut in pieces, put lemon and garlic and honey, you swallow like you're swallowing some tablets, and it can be very, very good. It's a natural antibiotic. There is chili, cayenne pepper. This cayenne pepper, but it should be used in moderation. And if it's very hot for you, you can use black pepper. There is black pepper. There is vinegar. Vinegar is very good at also moderating blood sugar, because COVID tends to precipitate sugar, and one can end up diabetic. because of its effects on the beta cells of the pancreas. Actually, that's why if you're already diabetic, like I am diabetic, you must now manage your diabetes very well because you're already at high risk. Yeah. In Uganda, to manage high sugar levels, we need to appreciate those foods that give us a lot of sugar, to know them and avoid them or control them. And these are the carbohydrate sources that are so common. Yeah. Talk of snacks, most of them are made of wheat. There is you start with the Rolex chapati, there is mandazi, there is bagia, and then rice, and then white sugar, and then you eat bread, and then I'm telling you, so if you have to be purposeful in managing COVID, go protein pro. Yeah, that's why
And
we
reduce
talk
on
about
carbohydrates.
fish, reduce on carbohydrates, or go more for low energy carbohydrates like greens.
Okay.
Greens are low energy carbohydrates and they have fiber to ensure your colon is clean. Hydrate a lot in terms of drinking water that is a bit alkaline, and we alkalize it with lemon. Lemon is acidic, but the residue in the body is like potash.
Oh, so
Yeah.
not to drink baking powder.
Baking powder, you can just take a pinch
Okay.
and put in a glass and then drink, not a lot of it,
Not a lot
because
of
that alkalinity makes it so difficult for the virus to thrive. Incidentally, most of our water on the market, if you really do pH, it's more on the acidic side.
Okay.
Yes. So in one day we can guide you on how to alkalize water, because alkalinity lowers down that acidity, which is part of that storm that is going on in your system. People of long ago used to use ash, wood ash. Wood ash, boil it in drinking water, or using a pot. This pot makes your water a little bit alkaline. Yeah.
Okay.
So yeah, and of course, fish,
Okay, fish.
oily fish, omega-3. Omega-3 is not only in fish, it can also be in what we call lentils. These are like beans on the market. Yeah, and some nuts. Yeah.
So, doctor, we are having symptoms at home.
Symptoms?
Someone has symptoms of COVID at home. They've been taking all these. When would one consider to go to hospital? What could be the warning symptoms that, you know what, having this, you now need to run to hospital?
Oxygen, the breathing. Some people call and even you feel the breathing. When somebody, you know, to me, I think that should be very evident. Low fever also, because you may not easily tell whether it's not due to
something else.
Yes. Yeah.
So, worsening breathing.
Yes.
If you're monitoring your oxygen level and it is less than maybe 90%, and I wonder what else can help someone to really understand that now it's other than that.
That's what?
You know, you've been managing yourself at home.
Yes.
But now because you're getting worsening fever,
breathing,
you need to run to hospital.
Breathing, to me, I don't even know how to describe it. I don't see how somebody can, the breathing becomes difficult and we still sit at home. That breathing. So that means self-isolation, where people go and self-isolate in a room. The home people must have a way of checking on that person.
Okay.
Not just to say, self-isolation. I've heard of stories of people being given food through the window and whatever. There is need to know what to follow. The person is self-isolating, but needs to be supervised. The people need to, put on masks and be able to access because it could be your child. And it's happening.
And they go into some kind of emotional torture.
I'm telling you, but it's really difficult.
So,
I've seen it's difficult.
Now that you've talked about this, why don't you wind up by telling us about, we wind up this discussion by looking at the psychosocial issues at home that one can get.
Psychosocial issues. There is still stigma. Stigma, it takes a brave person, first of all, to say, Bananga, I tested positive. And I've seen it but these are health workers. You find it's a doctor and tells the family, even at our places of work, somebody says, "Wanange," and they're doing good. Because we've hidden other viruses. It might not be easy for me saying I'm HIV positive, but with this COVID, it's important to be open. And when somebody is open, please don't push that person away. Because the thing is, today it's that person, tomorrow probably it's you. This thing moves very fast. There is need for supportive help, and we need to be open. You come into my home and you are coughing, and here in Uganda, Wanange, we are so secretive. You can't say somebody, Wanange, this time we've learned. You say it outright. You don't even apologize. You say, but when you say you are coughing, give something, so we need to get out of some of the norms that don't be open. We now need to be open, because if you're not, a life can be lost, and very, very fast. So,
well, thank you so much, Dr. Nambatia. Any final comment? Any message you want to pass on to the viewer?
Yes. Message I would like to pass on is that try hard not to reach that level of going to hospital. Because when you go there, part of care that is called they call emotional support, that one, everybody fears it. So it's like very likely that once they're getting back may not be possible. So when you think about that, think of just doing the simple things, that the SOPs that have been put in place, and let's walk the talk as adults, because the young ones that are affected now can only do what should be done by looking at what we are doing. Let's keep safe and healthy.
Well, thank you so much. This is all the time we had for tonight. We've been discussing COVID-19 and how to take care of that at home. My name is Henry Dungu, and this program is proudly sponsored by the National Medical Stores. Until next week, keep safe.
Was brought to you by
Your Health Chart is brought to you by National Medical Stores, ward mandated to procure, store, distribute essential medicines and medical supplies to all public health facilities in the country.